My name is Dr. Christine Kazmar. I am known as the Digestion Doc, and I help people regain their freedom from the crappiest health conditions like Crohn's, colitis, IBS. And what really sets me apart is I'm really interested in what's going on with the body from a cause standpoint, like what's causing, what is the source of stress, what is the root cause of stress, versus mainstream medicine, which likes to treat symptoms all day long. And so this actually happened today in practice. One of my dearest patients, I kind of think of her as like a second mom. So she came in today, and she had a really concerned look on her face, and she said, I have to run some things by you. I'm like, sure, shoot, what do you got? And she's like, I'm really concerned because I met with my medical doctor because I wanted to do a heart stress test. February was heart month, heart health, and so I wanted to be preventive and go get some tests, which, by the way, my disclosure, I think that's great. And she said, anyways, my blood pressure came back at 140 over whatever and 150 over whatever on the other side. And so the doctor wrote me out a prescription for cardizem. And so if you guys are watching, some other common names for this are verapamil, Norvasc. These are calcium channel blockers. And I'm going to do the whiteboard action to show you how this is tied into your gut and to digestion in just a moment. But first, I want to give you a little bit of background about why I'm going to do this video today. And so I'm like, okay, so does that sound like this is something that you want to do? Because full disclosure, I'm not a medical doctor. I don't belong dispensing medical advice when it comes to prescription drugs. But when patients ask me my opinion of things, I tell them, right? And so I'm like, how does this seem to you? I mean, are you thinking that this is going to really address the root cause of this problem? She's like, no, I don't think so. I think it's just patching something up. I'm like, yes. And so I said, you're under a lot of stress, because she is. We all are, but she has a lot to do with her husband's health. He has some things going on that she's been taking care of for a while now. He had a stroke several years ago, and so that there's a lot of involvement there for her, extra things on her plate. But what I'm going to talk to you about today is what I'm going to head into now, which is talking about how this happens and why I want you to really think about calcium channel blockers and whether or not you feel like that makes sense to you. Does that sound right, that we want to be blocking calcium from getting into our cells? So if I have a cell in the body, okay, the mineral that dominates inside the cell is potassium. Calcium to a lesser degree. What tends to happen as blood pressure increases, okay, or hypertension, or elevated BP, what tends to happen, and this is again my crude drawing, is that potassium starts to leave and calcium starts to dominate in the cell, okay? This is when you get high blood pressure. So the broken medical model, in their way of thinking, they think, okay, if we have too much calcium dominating inside the cell, let's get people on calcium blockers. Okay, so things like cardizem, Norvasc. I know many of you watching are on this. Verapamil. Okay, so the doctors say, let's put you on a calcium channel blocker to slow down the entrance of calcium in the cell because it's already too much in there. We don't want more calcium in there. We want potassium to come back, but we don't know what to do for that because we're a medical model and our way of thinking is by using medicine, not food. So their brains are thinking, okay, let's block or slow down the entrance of calcium into these cells, because what that's going to then do, it's going to relax the blood vessels. Calcium channel blockers do. Okay, it's going to relax the blood vessels, and so it's going to drop the BP. If you are in something called sympathetic stress, okay, or sympathetic dominant stress, there are two aspects of your central nervous system, the sympathetics and the parasympathetics, okay? The sympathetic nervous system, this is your fight or flight response. So this is that kind of aspect of life where you're driving down the road and a little kid in a tricycle pulls out in front of you, right? Instantly, you take your breath away, you slam on the brakes, your body is doing a whole bunch of different requirements in an instant, because that's how smart the human body is, to prevent us from hitting that baby in this example. Another example, you're at work and your boss is being a jerk or an employee or whatever is being an irritant to you. You start getting stressed out, you get into sympathetic stress, you want to fight or flight, right? You want to fight this person or get out of there, right? Over the course of time, the more locked into this state of stress, the state of fight or flight response that you are in, the more your body is going to lean toward acidity. So you're going to be moving towards being acidic, and you're going to be losing your alkaline minerals, which are potassium, sodium, magnesium. Okay? That is the reason why that calcium starts to dominate in the cell and potassium starts to be reduced in the cell, is in part because you are under emotional stress, you are under physical stress, or you are under chemical, environmental, nutritional stress. Do you see the difference? Mainstream medicine, the medical model is broken. It's broken because they're looking for quick fixes. They are looking at treating symptoms. They are never truly looking at this true source of stress in my example here too. So high blood pressure is very much linked to the gut when you understand that the autonomic nervous system has a lot to do with the gut. Okay? So as you are under this stress for longer and longer and longer periods of time, whether it's finances, whether it's your boss, whether it's your spouse, whether it's your partner, whatever it is, if you are not doing anything to fix or correct this emotional stress in my example, you are going to be locked into that state where your shoulders are tight, your shoulders are up by your ears, your mid-back is where the sympathetic nervous system neurology exists, is in your thoracic spine. And the longer you are left in that state of stress, the more you're going to lose your alkaline minerals. You're going to be giving up your potassium, your magnesium, your sodium. So the more stress you are under, the more plants you need to be eating. Okay, sympathetic dominance means you're becoming acidic. And this is where cancer can live. So if you're here for too long, this is where cancer can live. And so when you're under sympathetic dominance, if I'm drawing my little body right here, okay, all the neurology of the mid-thoracic spine control the sympathetics. Here I have a skull, okay? Here's the cervical spine, and then here's the thoracic spine. These 12 bones right there are the mid-back where your ribs attach. So my hands are not big enough, but pretend you have 12 bones right here. This is your thoracic spine. And these nerves, they continue to branch off. They're cut for this demonstration, but these nerves branch off and they control, in this thoracic spine, you've got nerves that control your lungs, your heart, your liver, your pancreas, your spleen, your stomach, your gallbladder. All the neurology of those organs are coming from this thoracic spine, the area of the spine that controls the sympathetics, okay? When you're under that kind of tension like that in this mid-back, T1 through T12, I know this is probably more than you bargained for, but I know a lot of you appreciate this kind of thing. So in that mid-back, this controls the sympathetics, so we're talking, it's going to control gallbladder, liver, stomach, all those organs that I mentioned earlier, okay? And so you are also going to be losing your alkaline minerals, like your sodium, your potassium, your magnesium. So you're going to be depleting these minerals when you're under this kind of stress. Okay? You're going to be depleting those minerals when you're under stress. Remember what I said to you. In a healthy cell, you want potassium, which is the symbol K, you want potassium to be dominating and a little bit less calcium. When you have hypertension, you have calcium starting to dominate and potassium is not where it should be. So mainstream medicine wants to block calcium with calcium channel blockers to slow down the entrance of more calcium. But what they really should be doing is looking at how can we have potassium restore back to the body. And so how do you restore potassium back to the body? How do you start stopping this process of losing your alkalinity? Well, you're going to eat plants. Okay? You are going to reduce your emotional stress. So whether that's through meditation, exercise, whatever that happens to be, this is the whole goal, to naturally improve your potassium so that you're going to regulate your blood pressure. A gigantic thing you need to be doing if you are somebody who either is on these drugs or does not want to ever be on these drugs if your blood pressure is a little elevated, is you want hydration to be really tuned up. So you should be closer to 96 ounces a day of water, okay? Give or take, depending on your weight and so forth. But these are some strategies to get potassium to increase in the cell and to lower calcium. So I hope that makes sense, that when you look at something even like high blood pressure, most of you watching wouldn't even think that there's a connection at all to high blood pressure and digestion. There absolutely is. So foods that are amazing sources of potassium are going to be your green leafy vegetables, celery, cucumber, cilantro. Don't forget your herbs. And when you use your herbs, don't just put a few little sprigs, use a lot of it, okay? When you buy a cilantro, don't just use a few little of the sprigs of it, like I said, or the leaves. Use the whole dang thing. So those are amazing sources of potassium. So are avocados. I'm not sure if I said cucumbers, but potatoes are actually good sources of potassium. Bananas are great sources of potassium and magnesium and so forth. So be looking at the body as a whole. Don't get scared, because that was the main thing, is that this doctor really scared this patient of mine. She got 2 bottles, not just 1 bottle of Cardizem, but she got 2 bottles in the mail of it. She hasn't started taking it yet, which is great. So it's just a matter of rethinking, what's the root cause here? Why is my blood pressure 140 over whatever, which isn't even that severe, but still, this doctor rushed to give her this prescription medication without talking at all about nutrition, without talking at all about emotional stress, without talking at all about things that she could do, to hydrate, or even alternative therapies like chiropractic, acupuncture, massage therapies, any of these things. Is I just want to tell you some of the side effects of these drugs, okay? So some of the side effects of Cardizem, Norvasc, Verapamil are headaches, fatigue, dizziness. Check this out. Congestive heart failure. This is a high alert drug, this Cardizem. And it's a high alert drug, and one of the things that makes it high alert is congestive heart failure, as well as acute renal failure. Okay, so renal means kidneys. Does that sound like it's something that you want to do? Again, you have to make the call. It's your body, not your doctor's. My job is, I'm talking about the broken medical model, and I'm letting you know that there are alternatives, guys. It's always your decision. So remember, love yourself healthy, you guys. It all starts right here. If you are not loving yourself, if you are not valuing yourself, that's going to create sickness below. All right. So your thoughts have everything to do with what I was talking about today. You don't want to be locked into sympathetic stress or that sympathetic dominance where you're stressed out all the time about everything. So this really applies to my closing phrase, which is love yourself healthy. All right.